Firstly, thank you so much for taking your time out to come and listen to me. My name, as Sadiq has mentioned, is Pema Lhaki. I live in Kathmandu, Nepal, Kathmandu is the capital of Nepal, and I'm a first generation Nepali. My mother is from Tibet and fled to Nepal and was a refugee there and grew up in the refugee camp there. My father was a political asylee from Bhutan. And so my father is from Bhutan, my mother is from Nepal, but I was born and raised Nepali. I studied in India since the age of 6. And so I also have that sort of influence. And for me, it matters because sociology, right? So all of that comes together. And then I'm married to a ethnically Nepali man. And so my son is all mixed. And now he's a blazer. Anyway, so yeah, today what I'm going to speak about is something that over the years I have seen, observed, learned, and I'm just putting forth things that I have seen and I want to share. Not necessarily that I have a solution to it, but the point of this is not only to share the work that we've done with UAB, also in terms of anybody who wants to go, and since this is with public health, a lot of people want to go out and work. I mean, these are the things that I think are food for thought to keep in mind, because at the end of the day, we know that health is important, but social determinants of health is also very important. And when you look at that, is where you have to think about how we're doing what we're doing, and if what we're doing is going to be sustainable and taken up. So this photo I purposely put, it was taken by a visitor, and this was quite some time ago, many, many years ago, in fact, way back. And I think I've changed a lot since then. I stopped wearing jeans and having my sunglasses perched on my head. Now I don't. But this is the type of mindset that I had when I first started working. I've changed now. This is not how I dress when I go to communities, because I have to respect and understand. And that's why I use this photo, and it's very heavy. That's why it was not loading on time. Anyway, so let me start by giving you an update on what I'll be speaking on. Briefly, I'll cover the background about Nepal, because I don't know how many of you know about Nepal. I think it is right that I should give you some context about NFCC, the organization that I represent, about the UAB and NFCC collaboration. As Dr. Shrestha has mentioned, it's been many years. We never even realized it's been 14 years. We felt like we just started working yesterday. And then the MERGE program, which has been quite a sort of reiteration of the good collaboration that we've had with UAB, but also in terms of what students can learn when they come and work with us. And then my main talk, it's 5 slides, but I'll be going in depth on 5 topics that I have worked on directly or indirectly. And at the end, if there's any Q&A. So let me start with Nepal. How many of you know Nepal? I think, yeah, okay. Okay, many of you know Nepal. Okay, this is also a special photo, because with UAB, we've been championing HPV, cervical cancer, and WHO took out a call that countries that want to support HPV and the commitment to HPV and cervical cancer should advocate to light their national monuments in the teal cover in November, and we did that. One of the oldest monuments in Nepal. So I'm going to start talking about Nepal with this slide. Nepal, for context, as you can see, it's like really, it's small. It's far from the US, as you can see, and it's between, everybody says it, but it's important to again state that it's between India and Nepal. The two like big powers now, and the roles that they also play right now in the way that women's health and health in general and development is sort of changing in Nepal. Some facts. Recently, 2017 is when Nepal federalized. The monarchy was like sort of ended in 2005 when the king left, and then then they had democracy. I mean, democracy had come earlier, but then there's a slow transition. But finally, in 2017 is when Nepal fully federalized into 7 provinces. Earlier, they were like, it was not provinces, it was development regions, and also they were fully federalized in terms of at the ground level administrative decentralization actually started in 2017. Now we have 7 provinces, or like in other places like states, as you say, we call them provinces or pradesh. We have now 77 states as opposed to, districts. Pardon me for that mistake. So 77 districts. We had originally had 75, so two districts split up. We have 3 major ecological regions. And I mentioned this because it just adds to all the challenges that come when you do anything to do with development or health. These are very important considerations that you have to keep. And as I tell you about the HP book, these things came into play also. 2021, we had a census, and it's close to 30 million, the population. And yeah. The DHS that you have here, we also have the NDHS, which is supported by USAID. And the latest findings was this, that women are leading 1/3 of households, which is such a change in a patriarchal setup like Nepal. But this is primarily because there's such high rates of migration. 74% of women and 89% are literate. Fertility rate has gone down. Now it's gone down to 2.1 children. 3% of adolescent women are married before the age of 15. And this is pertinent because this is another big area that we work in terms of early pregnancies and all of contraception, making sure that adolescents have access to right if they land up getting married. 14% of adolescent women or age 15 to 19 have ever been pregnant. And 57% are using any type of family planning, and 43% use any modern method. Sorry, that was repeated. And the most popular method is female sterilization or mini-lab, followed by injectables, which is called DNPA, injectable. In Nepal, there's a brand called Sangini, and that's the one which is the most popular. I say that is the most popular because female sterilization is after most of the married women decide, I don't want to have any more children. They just seem to go and say, okay, I'm going to get a mini lab. So actually, when you talk about the temporary method, it is injectable, the hormonal injectable contraceptives, and then implants, which is also hormonal. 4 in 5 women own a mobile phone, and 3 in 5 women own a smartphone. And all of this is from the latest NDHS report. Very, very important to us when we are planning, the next round of activities or work. And the total fertility rate, as already mentioned, is 2.1. Now, why do I mention family planning and contraception? Because that's going to be a big part or a crucial part of what I'm going to speak to you about neocolonialism of women's health. And that's where also contraception comes in. And that's why I wanted to mention that. So back to little fun facts about Nepal. Everybody, I think, knows. Yesterday, I met somebody shopping for my son at Costco. And he said, where are you from? How come you don't know Hot Pockets? And I said, I'm from Nepal. He's like, Nepal? I said, Mount Everest. Said, oh, okay. So Mount Everest. And Nepal flag. I'm very, very proud of the Nepal flag because it's the only flag in the world which is not rectangular in shape. And I went for the ICPD meeting in Kenya, and I actually, and Dr. Jolly said I'm passionate. I think sometimes I'm over passionate because I actually had the secure, you know the ICPD meeting, right? The first one which was in Cairo, and this time it happened in Nairobi. And in the 90s, it happened in Egypt, and it's quite landmark for contraception and women's rights, human rights, and all of that. So it happened in Nairobi, and so I saw the Nepal flag, and it's upside down. And they had also put the Nepal flag and attached, like they made it in the shape of a rectangle, and then they had the outline of that. So in a sense, it was still a rectangle flag, but the other part which was not part of the flag was white. So Pema can't take that type of thing. And the other bad thing about Pema is I have to have an opinion and I have to say it. So I called security and I said, A, you have my flag upside down. 2, it is the wrong shape. So bring scissors and bring the security. And I have a video if anybody's interested. So they literally brought it down, cut it up, and put it back up. And so, yeah, I mean, we were very proud of it. I mean, a country like ours, there are certain things that we draw happiness, I guess, from and pride, and this is one of it. And Buddha. I'm assuming everybody knows Buddha, but let me tell you, there's a lot of like discussions on social media platforms. But Gautam Buddha, who founded modern Buddhism as we know it, he was born in Nepal. Right now, what is Nepal? Okay, so and why I say this is if people from South Asia region know it's a very sensitive topic, so I just wanted to share it. This is very important. Did you know that in the 60s, Nepal was called the wheat capital of the world? Yeah. So what happened, and why am I sharing it? Is because even at that time, neocolonialism was happening. Because there was so much of income Nepal started getting from apparently Vietnam War veterans and a lot of international, like people from Europe, they used to take the bus and come because you had really good marijuana. And so there were a lot of international politics and discussions, and then it became illegal. And Nepal lost their whole income, which now again it's becoming legalized. So it's like, it's very funny, but I just wanted to share this. I just find that very interesting. So this is actually a street you'd have like in the 60s street with a menu with cake and pancake and whatever you have it. In fact, my mother also knows how to make marijuana pancakes because that's what they used to give the tourists who used to come to that little town where her camp was. This is weird photo, interesting photo, but this is to show the Anglo-Nepal War. Nepal has never been colonized. We're so small, but it's interesting that we have never been colonized by any foreign power. Okay? And lastly, Nepal is small, as I said, but look at the diversity, apart from the terrain. Imagine, and I look at the population, it's not really so much. For that land, it's a lot, but overall, when you look at a country's population, it's okay. But then we have 80 ethnic groups. We have 123 local languages. And this is anecdotal information. Dr. Sreshtan had a lot of discussions about it, but the other thing that people say is Nepal is a place where there has never been a major religious or communal riot. So it's interesting how people have learned to coexist. I think it's because Buddha did it, right? So, okay. So let me go to my next. Now I want to share this. I don't know how many of you know that Nepal is also a place where Kumari, the living goddess, lives. Do you know, how many of you know about? She is worshipped till today. And why I put it here is because she's chosen and there is certain criteria, but she loses her status the day she has a menstruation. So it's interesting. And that's why I want to share it, okay? NFCC is in this district called Lalitpur. And in Lalitpur, one of the biggest festivals is a sort of a chariot festival, and that's the chariot. It's called the Rato Machindranath Festival. It's a month-long, sort of a very community, every community comes and they pull and they take it to the next locality, and then the people from there pull it to the next. And it's a very, it's a big part of the yearly calendar, and it's a lot of fun. But what is interesting is that is Ratu Machindranath, the god. And do you know that Machilanath is not male or female. In fact, they say Machilanath is both. So these I find very interesting because I work on sexual reproductive health and rights. And so these several things I like to share to people outside of Nepal who don't know. Okay. Now that I've given you some context on Nepal, let me talk to you about NFCC. NFCC was established in 1988 by a doctor who did his MPH from UNC Chapel Hill. He was an expert on family planning. And we at NFC, and it's been 34 years now, and there are 4 things we do. We work on evidence building, which is related to research. We work a lot on capacity building to build and train people. We do a lot of implementation work, which means ground level implementation, and we do a lot of advocacy, advocating to government to change policy, to do work. And the areas that we work is HPV, cervical cancer, which we've been doing, as mentioned by Dr. Shrestha, with UAB. We work on quality of care in health services. We work with a lot with adolescents. We work on menstrual health, and I'll tell you a little bit more about that. And with this, we actually have a collaboration with University of Pittsburgh. We work on gender-based violence. We started working on latent TB, zero TB in Himalayan populations, and this we are working with Johns Hopkins University. It's the second year that we've started work. And refugees. Yes, I went back, and now we are one of the few NGOs that work with Tibetan refugees. And by virtue of that is why we work in TB, because there is a very high rate of TB among Tibetan refugees. And since we are the only ones who work, we had to sort of relearn and integrate that part into our mandate. And finally, contraception and family planning. NFCC was established for that. Okay. So now let me quickly go through what UAB and NFCC has done till now. As Dr. Shrestha mentioned, it's been 14 years. Just some of the things in 20 we started, we did a nested pilot into cervical cancer work. All of this, see, we've done a lot of work. Our work stopped during 2015. We had one of the major earthquakes, and I think there's a lot of fundraising also done from UAB, right? Yeah, so this collaboration, a partnership between UAB and NFCC, we have done a lot of work and a lot of pioneering and good work, because now we are actually selected to provide technical assistance to the government as they are going to deploy HPV testing. And I think that speaks a lot about, that now they understand that the amount of and the body of work that we've accumulated actually is good and can support. So we are actively working with the government in 2 districts, okay? Okay, some of the photos, these are some of the camps, and these are all the work we've done with UAB. Those are camps. Look at the women who wait to get screened. That's one of our local leaders who has become such a champion for cervical cancer that he provided space, and with him, we are assisting him to set up a lab to do HPV testing, which was a machine provided by NHRI under UAB. And the first Women's Health Conference was held in 2023. So imagine, in Nepal, the first Women's Health Conference solely focusing on women's health was held in 2023. And we, that is NFCC UAB, our collaboration, which is the Nepal Health Research Initiative, was invited to do a whole session on cervical cancer. So those were good moments. Till now, we've done 7 studies, we've published 10 papers, we've completed 5 projects, we have 2 ongoing projects, we have 2 ongoing studies, and we have the MERT program going on, okay? That's what we've done. What we're doing now, a little bit more, is we're doing a head and neck cancer study with funding from the Sparkman Center. We have other ongoing research which we are doing, which is on self-sampling, the uptake of self-sampling among women who we approach randomly, and whether they would be okay to do it. We are also trying to see whether we can detect HPV in menstrual blood. We are deploying HPV DNA testing at Ward 3. I showed you the photo earlier of Lalitpur. I'm sorry about the acronyms. Dr. Sreshta always tells me you'll use too much acronyms. This is Lalitpur Metropolitan City. We've been selected as a national coordinator for the International HPV campaign by the IPVS Society. And recently in April, I was selected as the global IPV ambassador for Nepal. So I think this is a culmination of all the work we've done. Whatever work we've done on HPV and cervical cancer is thanks to Dr. Sreshta and thanks to UAB. And I think because of that, we've been able to be recognized like that. We've had a lot of UAB students. This was one of the first students who came. He was Derek Johnson, I think back in 2011. He came, he stayed for 18 months. When he left, he was more Nepali than I ever will be. I have to share this funny story about him. You know, we have the most famous things that you eat in Nepal for lunch, and people would know is momo. And everybody likes to eat momo because it's like dumplings. And what happened is that, so our colleagues used to go together to have lunch during the lunch break to a local, very local place where Nepalese local people eat. And he used to go there and he was eating, and later on, the owner started asking the Nepali staff, will Derek be coming? And they're like, why? You should tell, because we want to hide the chili. Because he had started eating even more chili than the local people. So he used to think to say, can you tell him not to put it? He's like, how can you tell him? Because over there they just put, the sauce there. So that's how he had totally like sort of settled into Nepal. I think we've had successful, working relationship with him. We published 5 papers. We continue to engage with him on our other projects that we do with UNICEF. We have an 8-year running program with UNICEF, and so with the data management and analysis, he still helps us. With the Sparkman Center, we have as I mentioned, the head and neck study, which was the pilot funding. We are creating medical records, and we have a 20-page questionnaire, which is very tedious. We have a target for 100 people, and we finished 87 people. It got a little bit hit by the COVID because we were supposed to start, but because of COVID and it was a hospital, there was a lot of like, okay, we need to stop all of that because, I understandably. So again, it restarted after this. So I think we made good ground. And also Amrita, who was helping us with the head and neck study, then we were able, because she started collaborating with us, we also were able to work with her on another paper, which is to do with menstruation. That's Amrita in Nepal with one of my colleagues who was looking after all the HPV work earlier, Ingma Lama. This is the first batch of MERT. I think it was 2018?
2018.
Yes, okay, 2018. And so that was Akilia Simoy from Georgetown, and then there was Fatima from Tufts, and Suhaila, she was from here, Shefa, right? We were able to have a paper published. I think that is good, because not only did they learn about working there, but be able to publish. So I think that was really good. The next batch in 2022. 2020. With Esther and not. Yeah, last year, no, they came. 2022. Yeah. So we had Esther, and they were the first after COVID. So all of us are masking up because we have no idea what's going to happen. So anyway, so they came, and Esther is from University of Texas at Austin, and Elizabeth was from East Carolina University. We did really interesting work with them, and we had this work going on, and so they learned about something is the changes in premenstrual symptoms, menstrual symptoms, and menstrual flow after COVID vaccination and infection among adolescent menstruators in Nepal. And this is something that I know that they did it outside Nepal, but there was no research or evidence of what happened to young Nepali menstruators. And so that is what we did. We just try to get local context and local evidence. And the other one was assessing the availability and public perception of basic menstruation-friendly facilities in public-private sector toilets in Kathmandu Valley, very associated, very related to the work we do on menstruation. This is a photo of the recent event we had in Nepal, where we launched the first app for adolescents, menstruation app in local language, contextualized. That's the Kumari. So we made one of the, because they are stopped from becoming Kumari, I literally argued with UNICEF and made sure that there was a avatar you could make of the Kumari. So it was interesting. So they said, okay, go ahead. So that's Shivani. This year MERT interns. That's Shivani from University of Tennessee, Knoxville, and the upper what the classes, and below her is Monica. I don't know whether I got her. I always get good. Okay, yeah, Gutierrez from San Houston University. With them, we are working more now, on the HPV. There were two arms, and we are comparing uptake, acceptability, and viability between two sample collection methods for HPV testing. So one is invasive but validated, which is HPV testing, but we are trying to see whether they want to take up self-sampling. And the other is a non-invasive but experimental, and that is whether they will donate their pads where we can detect. And we are very, very excited about that. Hopefully, we will have some good information and data we've already collected, but now I think we need to analyze it. So I think that is why I'll be staying and we'll be doing a lot of the work there. Okay, background finish. It was long, but I come from far away. You saw, as in Nepali we say Sat Samundar Par, which means beyond 7 seas. So I had to give you a lot of context. I want to say that the next 5 slides are my opinion. It doesn't necessarily mean NFCC's opinion or our collaboration. It's just something that we, as a person, having worked on public health and reproductive health, has learned and observed, and I want to share, because in a university like UAB, but there are a lot of students who want to go out to and all over the world to work. I feel like these are the things that we need to keep in mind. Because if you want, everybody wants to do good work, everybody wants to do work that works well and stays forever. But what we've learned is if these things are not kept in mind, it might not happen. And so what I'm going to share with you is the areas that I've seen. I can't be speaking about agriculture because I don't work on agriculture, but I can tell you about the areas we work in. What I have observed are very neo-colonialist practices that I feel are doing more harm than they are doing good. Okay? And I'm not trying to say that people actually come with that intention. Sometimes we don't know. Sometimes we don't realize. And then, so just sort of food for thought, as I mentioned, to keep in mind when you're planning and working, So again, yeah, so contraception, okay? Back to facts. Contraception, and I like to bring this up because every time I have discussion, contraception in Nepal is free and is freely available. You can walk into any primary healthcare service and you will get it. No questions asked. Absolutely no questions. And abortion is legalized in Nepal. Actually, I worked in the organization that worked to legalize abortion before I joined NFCC, but it's legalized. Okay, so you can actually walk into a health facility and get. Nepal has some of the best records when it comes to LGBTQI rights. Incidentally, a very close friend of mine was the one who put the first public case against the government of Nepal. It was Pant versus Nepal, and he actually got the government to recognize that there is discrimination, and so the Supreme Court ordered the government to sort of review and change the laws, and over 100 laws were ordered to be sort of amended, changed, so that anything discriminatory in terms of action or even like indication in terms of language, they needed to be removed. 2010, Nepal allowed the third option in the polls, And then after that, the immigration also followed suit, which means that passports would have that option. And then in the same year, Nepal became first country in the world to include the third gender into the census poll. So I feel very proud that this is an area that we work, and there are strides. We are a small country, but I think those were good strides, I feel, you know. And vaccination. We have very good vaccination coverage. I think it's also the mindset that let's vaccinate and prevent, because we know that if the problem happens and we go, it's going to be difficult. So this long history of this work that's been going on, and the fact that there are vaccination clinics all over, made it quite easy that when COVID hit and there were vaccination, everybody knew where we could go and get vaccinated, because it was already a very practiced thing, you know, vaccination. So we have at least over 80%. In some places, they hit even 90, 95. Some places also hit 110. And everybody's like, how is 110 possible? That's rubbish. But what happens is actually it's not that. What happens is the people, and so we were joking about that, you know, like even when we had the HPV vaccine. So what happens is, you know, Nepal has that porous border with India. And so people walk in, and there are a lot of people who have papers, and so this is register and put. So when they have the planning, they have, okay, I will vaccinate 2,000, but they will end up vaccinating 2,015 people. So that was apparently the situation. So yeah. And Nepal has officially already committed and started HPV testing and vaccination free, or in the process. So we are working with them to make that available. I think those are good strides, and now you understand the context in Nepal more, apart from the other one was about demographics and the culture. This is about this field that I work in. 1920, Nepal received foreign aid to the tune of 369 billion. So very, very dependent on foreign aid. And why I mention this is then the aid comes, and that's when how we live our life starts changing, because there are people teaching us how to live, you know, and go about our way. And I'm not trying to say that everything is right, but I think there needs to be a point when we observe and say, okay, this is good, this is bad, and maybe this is how we need to go about it. So today I will speak about 5 things. Now, 5 slides, my opinion only. I'm going to speak on menstruation, because we are one of the first organizations to work in menstruation since 2008. I am a part of the Global Advisory Group on Menstruation. I've been working forever. In fact, the first menstrual hygiene day, you guys, everybody knows the menstrual hygiene day, right? May 28th, you know, that International Menstrual Hygiene Day. It's funny because when the first it happened, and it was started from Wash United, we celebrated it in Nepal. And then I came to the US, in New York, met some people and helped them celebrate the first menstrual hygiene day officially in 2015. And if you go back, that is when it started. And so we have a lot of experience working on menstruation, on contraception. As I mentioned, we were established to help the government, you know, sort of reconcile and plan the reproductive health program, but the family planning program. HPV, as I've already mentioned, thanks to UAB. And I'll also be speaking about 2 things that not necessarily we work on, but it affects us directly. Breastfeeding, because it's directly related to women's health, and we work a lot with women and rights in health. And volunteerism, because we are an organization that we conduct the MERT program. And so even though we are very aware of how we should work, there are others who bring it a bad name. Volunteerism, have you heard of the term volunteerism? It's actually coined and endorsed by UNICEF. So the fact that it gives a bad name to organizations like us, who have students who come and who are doing good work, you know, so I think you should understand that. Okay, let me start with menstruation. The photo you see is one of the communities we work, and that is a menstrual hut. So that's the main house, that's her in the menstrual hut. Does she look sad? Does she look sad? The woman who's staying there? Yeah? So my point is this, that I'm not saying that it's a good or a bad thing. You know, we need to understand why they do what they do. Okay? So the context is that menstruation in Nepal is very complicated because it is riding a lot on the Hindu religion, which is the majority religion there. Okay? There are a lot of restrictions, a lot of restrictions. I'm not Hindu. I don't subscribe to that. Also because I don't believe in that, but it's there. It's everywhere. Okay. And so our experience is with the first work in Nepal on that. We've done a lot of work on restrictions, on menstrual health, on menstrual hygiene. And we realized that, oh my God, we live in a country that we can't work on menstrual health. We started with, we'll work only on menstruation as a part of the reproductive process. And then we realized we can't really ignore health rights and hygiene because they have quite poor hygiene. And why they have poor hygiene is because of restrictions. They can't enter kitchen, they can't use water sources and all of that. So that's how we landed up working. And then, because I work on women's rights, I believe very, very strongly in that. And we realized that there is one day holiday in Nepal, which is given in this coming month, and it's called Rishi Panchami. And Rishi Panchami is the day that only females, in the calendar is written, it's holiday for women. And you know why it's a holiday? Because on Rishi Panchami, all Hindu women, they go and they clean themselves 365 times to atone for all the times they have defiled anything when menstruating in the past. So they brush that many times. They wash their vagina that many times. Can you imagine? They do that all over, and they go to the local river and do that. And I was like, oh my God. But then I also understand, who am I to say? I don't practice it. But I don't have the right to go and tell what you practice is wrong, right? So at least that is not the approach there, right? In NFCC, we don't approach it like that. But what we said was the government of Nepal cannot give a holiday for women that day, because indirectly they are endorsing that women are unclean, menstruation is dirty, and they need a day to clean themselves. So you know what we did? In 2017, we filed a public interest litigation against the government. Because at the time, when the whole next year holidays come, so every year they change the holidays and they say, okay, this year this many holidays and all of that. And so what we said is, we're not saying that women can't celebrate, because again, right to self-determination. Every menstruator can decide what they want to do and not. And that is the principle that we worked with. But state cannot give a holiday, because when the state gives, you reiterate that it is dirty. And they canceled the holiday since that. Since 2017, the government has dropped Rishi Panchami as a holiday. And so that's the type of work we do. We are really, really involved in advocacy, in rights, now if you go to a lot of the developing countries, you see, right? A lot of them teach, people how to stitch pads, right? You've seen the photos, right? I'm sure you guys get updates on social media. Oh, we taught 50 girls how to stitch pads. Oh, we taught, and we gave like that. Back in 2009 was when we went to one of quite rural area in Nepal, and I myself, that was my first project I did with $10,000 from UNICEF. They said, do it. They had so much faith in what I said. So we set off, and with around 200 girls, we taught them to stitch pad and sort of make pads and use it and sell it. It doesn't work. The first learning we had was, you know what? It doesn't work. Because I am coming from a place where I think the best thing to do is make something for menstruation in the shape of a pad, because that's what I'm used to. I didn't stop to think at that time that, hey, you know what are you using? Maybe that can be improvised. So why I say this is because I myself have learned. And from that day, NFCC, we have stopped telling women, this is the thing to you, or that is the thing to me. We ask them, what do you use? We need to start from there. And not only was that, we learned very soon. So now we are very opposed to those things, activities like that, unless somebody says, teach me how to make a pad, then we'll teach. Because we are one of the first ones who made the whole, training program for that. But we are not going to go to somebody and say, hey, you know what? Let me teach you how to make a pad. Who am I? I don't know what she's using, right? So I think that is important. Neocolonialism is not only from one country to another. I think it's also there. As I showed you in the photo, as I showed you on how we were earlier, I think there's this realization and this changing, in terms of how. And now I think we've made our name as being somebody. We were awarded in 2018 by this foundation called Kulchik Foundation for of all the organizations, hundreds of organizations across the world who work on menstruation, 8 were chosen as the organization that does the best and most comprehensive work. And we were the only one from Nepal, South Asia, and Asia. Must be something we're doing right? And this was like research they did. They didn't just come and say, hey, you know what? They actually interviewed, and we didn't know what was happening. So they interviewed, what do you do? What did they came and observe? So I think it's a learning process to learn. It doesn't mean that people make mistakes, but I think realizing this, So, and Chaupadi, as I'd already mentioned, it's something that we've been working on. We were very involved in advocating and having the Chaupadi policy passed, wherein this was, I think, this was in 2017. It was earlier, 2005, it was criminalized, but it wasn't that there was any legal repercussions, but after that, people can go to jail if you force somebody to sit in Chaupadi. Yet women go and stay. And so now we realize maybe that was wrong, right? The status is that we have a Chaupadi policy, yet 2 weeks ago, one young girl again died in a hut. She again died in a hut because she was bitten by a snake, right? Restrictions still continue. But then what we have is now where I see a problem is we have a policy, and the policy, what happened is we said there needs to be something, there needs to be repercussion for people who force people to sit in the hut. But what happened, they made a policy, they said you have to write a, complaint against the person who's making you do, but most women who practice Chaupadi don't know how to read and write. Loophole. That's a loophole, right? Restrictions. Till date, even in Kathmandu, females, if they are menstruating, majority of they don't go to the kitchen when they are menstruating for 4 days. And what I heard is a lot of Nepali families practice, not a lot, but some Nepali families practice that in the US too. Now, there are females who are being stopped from entering the kitchen. And when we have that discussion, you know what is the thing? They say, oh, we're giving them holiday. So if somebody is giving you holiday for 4 days, that means somebody is making you work for 26 days. Let's talk about that, right? Now the problem, what happened is, again, as I mentioned, that we are in the global advisory group. And so we have this big hoo-ha about menstrual leave. And my colleagues across the world were celebrating it, especially from the global north. They were like, this is a milestone. And so I went and said, is it? Is it a milestone? Because when that law gets integrated in Nepal, you know what? The people will say, oh, we were way ahead. They give 1 day, we give 4 days. So how is that impacting? How are, things happening without thinking how that has a repercussion in countries like ours? And that is the basis by which a lot of their rights, they can't go and get water from that kitchen. So they have to wait for somebody to bring them water outside. It's like that. People don't talk about it. And a lot of females, what they say is, oh, it's okay, yeah, Pema, you always complain too much. At least I get break. And I always say, somebody is determining whether you can go to kitchen or not go to kitchen. There's another conversation. It's not about holiday. You decide. You can decide whether you want to go to the kitchen when you're menstruating or not. But now we have a menstrual leave policy, right? Which is already passed in some places, and now it's being championed across. And believe me, that will now filter down to countries like us. Now, what happens? Women like me are slowly entering the workforce, getting decision-making positions and everything. You think people will want to hire us? You think they will want to hire? They won't. We already have a problem that females get pregnant and they have to give maternity leave. So now think about that. That's one more thing that we add. So what I'm saying is, when we have people who come and champion and make, we have to see that, because it impacts in this day of social media and so much of information consumption. I think those are important. Pad distribution, best for the optics. People come, distribute pads, go. But did you think and ask, what are they using? If they're using cloth, why don't we tell them use cloth? Just use it correctly. It's very good what you're using, because the whole lot of people are now moving back into not creating menstrual waste and everything. But no, people are still distributing pads. And one person came and asked us, saying, one foreign organization, we want to distribute pad to all the 5,000 adolescent girls you're working with. I was like, sure, but you give me guarantee you're going to give her pad until she hits menopause. And they're like, no. I said, then it doesn't make sense. You're just going to give her 2 packets, and what do you think she's going to last? So I think those type of things need to stop, And then menstrual cup, we did, okay, sorry, I'm like running late, but so menstrual cup was something we did, the Ruby cup, uptake and acceptability. It didn't work for adolescents because people have that, they don't want them inserting something in their vagina for young girls. Women didn't want to use it, but then they also have to wash it and sterilize it, which they have to do it in water. You're not allowed to enter kitchen. How do you do it? Right? And there's so much of stigma with menstrual blood. So again, that's a problem. I think representation is important. When they have global discussions, when these type of things happen, you need to represent the voices of communities you work, what their practices are. I think the stereotyping, because when you do that, there's a stereotyping that's coming. So you have to look into stereotypes. There's a stereotype that all Nepali women stay in chowpatty. That's incorrect. It's just one part of Nepal. So I think those type of things need to stop. I think menstrual leave, I've already mentioned it. And menstrual waste, because of the pad distribution, the menstrual waste is enormous. I'm sure it's a problem here. It's going to be the next biggest problem. And I don't know how that is going to be solved. And then the self-determination. When we decide and tell a woman, I think you should use pad, we need to also think that we are taking away her right to self-determination, because we are making the decisions for her. Firstly, her husband will make the decision, and now because we think we know all of it, then we make the decisions. Okay, quickly I'll go. So I've already mentioned, so that's menstruation. And now in contraception, it's a right. We have all these products free. NFCC has been a pioneer of working on family planning. All of the 5 products that are methods that are in the government's program, we have, sort of done the uptake acceptability. The status is it's free, it's available, CPR has increased, but then it has also impacted fertility. And why I'm saying it is, I don't know whether there was enough research done when some project brought the injectable contraceptives, the hormonal, and made it the most popular one. Because now we are seeing the fallout of that. Do you know that the return to fertility rate has gone down? People are not being able to conceive in Nepal. So that was, again, somebody came, made that into a program, but did not think through and understand, does it work in long term? And I think this injectable contraceptives works all across the world. It's not just for Nepal, it's for women at large. I think there needs to be more research in terms of who takes responsibility for contraception. And so we need more research on that. And the fact that there's no research is already an indication that, hey, you know what, we know best, we will decide for you. Why don't you do it? Because we come, from a place with money, So I think that's a very big problem that we have. HPV. I've already mentioned to you all the background. We've had a long experience working on it. We are providing technical assistance. Government has endorsed the WHO's 90-70-90, which means by 2030, countries will, commit that they will vaccinate 90% of adolescents, 70% of women will be screened, and 90% of the 70% screened will be treated. We have HPV testing, HPV vaccine. But I was asking Dr. Toshi, is it there in the US? And even over here, they haven't rolled it out. Now imagine in a country like Nepal, when WHO sat and made that thing, that big commitment, how is a country like Nepal going to do it? So I think you need to set achievable targets. And that was quite a difficult target, which our government had to jump in because WHO was involved. So I think you need to do more research. I mean, I know there are vaccines there, but we need more research. What are the HPV types? What's happening in Nepal? Do they need the nonavalent? Do they need the quadrivalent? What is it? So there's not enough research. And I think just people coming and saying, we'll give you this vaccine, do it. I think that is not good. They need to understand what is the situation on the ground before they even give that. I think when there is inequity, because through endorsement, there's already going to be an inequity in terms of which countries are able to vaccinate and provide testing for people as opposed to us. And I think that's not good. I mean, it reiterates, the position of Nepal, and I don't think it's good in the long run. HPV vaccine. I mean, they are good vaccines, but because of vaccine diplomacy with China, China is pushing a vaccine which we've not had access to the data, and apparently 2024 is when the third phase trials findings are going to come. But guess what? Nepal government already got a shipment of vaccines, which is the Chinese vaccines, and they're going to start vaccinating. So that's how China is also trying to control Nepal, and that's going to affect. And I don't mean to say that it's bad, and maybe it's a good vaccine, but people need to know that the findings will come, and that's the point. If you don't give people information, then you are taking away their right to self-determination. And then this breastfeeding. Breastfeeding in Nepal, like a lot of South Asia, is universal. It's practiced everywhere. It's not sexualized. It's not sexualized. I mean, it's a common place to see, and nobody looks and says, oh my God, like it's common. I breastfed my son till he was 3. So it is so common, but it's changing now. It's changing now because apparently some project, and this I'm taking it very out there, I've been advocating because I was like, in 2018, the government decided to announce that, hey, we're going to have breastfeeding rooms. And I said, why? You can make a room, but why breastfeeding room? And there's been a decline of females breastfeeding from 70 to 56%. There's a big rural-urban divide. Rural people are still breastfeeding, and urban, they've stopped breastfeeding. It's reducing, not stopped, but it's really going down. And then also the NDHS, which I mentioned earlier, showed that the more educated women are, the less they breastfeed. And so what happens is that the reason why I have a problem with this is, till now, if all Nepali women are breastfeeding openly, people are not sexualizing it, and it's there, you are going to create a room, and then guess what the women are going to think? Oh, I should be hiding and doing this. It's not, I should not be doing it. It's not natural to be sitting out and doing. And I think that does harm long term. In terms of, again now, with menstruation, it is stigmatizing breastfeeding too. So this is something that personally I have a lot of questions about, and I'm still not convinced that it's going the right way. Okay. I think there's a lot of people from, there's something called Sanskritization where lower castes want to ape the ways of the higher caste. And so that's why people want to think, oh, I should not breastfeed, I should give bottle feed because all the rich people are doing it. You are creating stigma about breastfeeding. Okay. And finally, I'm rushing, sorry, because I'm just totally. This was an ad that was shared to me on LinkedIn. And if you read it, it is said that one European university is looking for NGOs to partner with because they said that their new bachelor students will come to the NGO to help them tackle their pressing problems. Imagine, bachelor students. My son is starting bachelor's. I don't think he can arrange his clothes also. He's going to come and help me tackle the pressing problems. I have a problem with that. I don't know. Yeah. So it's like volunteerism is the number one thing in Nepal just now. What happens is there are people who come for 1 month and they volunteer at schools, health facilities, you can't because then you need the thing and all. But tourism is the biggest industry in Nepal, and close to that is volunteering. And they're not allowed to volunteer because Nepal immigration has strict laws, but not implemented. And so the status is, because there are a lot of foreigners who come and want to come on a trip and also do some, sort of social work, and I'll teach. So they come, and there is such an explosion of orphanages where they have little kids who they come and spend 1 month, 2 weeks with and teach them English. And what happens with this is there are a lot of parents now in the villages who don't have a problem having more kids, because the problem with having kids is you think, how you'll raise them. But now the orphanage will raise them. And they found out that most of the orphanages that are there, actually the children who are there, they at least have one parent living, if not both. I myself participated in a raid in one of the orphanages. It's like that. And so what happens? It perpetuates volunteerism. It perpetuates that colonial mindset. Oh, doesn't matter if it's a young kid, if they are from the West, they'll come and teach us. I think that's really wrong. And I think that's creating a lot of problems, because to cater to that, more orphanages are being opened, more kids are being recruited from the villages and put over there, because not only are the children looked after, they actually send money to the parents too. And so this has been labeled as child trafficking by UNICEF, because it is. You are taking children from their homes and putting them into orphanages. There's a very high rate of abuse of these children. And not only abuse, a lot of these children we now there's new evidence that they are facing psychosocial trauma, because somebody comes, little babies, and stays with them for 1 month, and they become very attached, and then they leave, and then the child cries and cries until the next person comes. It's not good. It's not good for the child. So volunteerism, it's this new way of coming and showing power and control, and to cater to that, the whole society is like sort of changing, and not with good consequences. So what is it? What am I trying to say? I'm not trying to tell people don't come. I think it's good. We learn, we do everything, but just some food for thought. We need to decide whenever we travel, are we going to learn or are we going to teach? If we are going to learn, let's go with that mind that we're going to learn. If you're going to teach, if you have the qualifications that are needed in that place, then great. And this I mentioned because at MERT, we are very, very, sort of careful about this. We make sure that, the students have an orientation about the practice. We make them eat local food. We make them understand. I think these are important. I think we need to understand local context. I can't reiterate that. Even I try to understand the local context, every community I go to. And finally, human-centered design. Everything you plan and do, you need to have the human-centered design where you put the person you're working in the center and tell them to tell you, what is it? What is it that they want us to do, and what our skill set is, and what would they want us to do? That has worked for us. So that's it. I hope that food for thought would help you become amazing at doing development or public health work that you go and do. Good luck with that. Acknowledgements. I would like to thank the MERT program for bringing me here. Dr. Pauline Jolie, Sarah, and the NFCC team, Rubina and Anamika, who work with me. The Nepal Health Research Initiative, which is Madhav Bhatta, Dr. Jitendra Parya, Dr. Sri Krishna, Dr. Charita Tuladar, Joanna, and my mentor, Sadeep Shrestha. He taught me everything there is to do about HPV and cervical cancer. Thank you so much for your attention. I'm sorry I took a little bit longer than expected. Thank you.